It's ready?
Yes, ma'am. Yes.
Yes. Okay. Good morning, good afternoon, or good evening to everyone. My name is Juan Weilin. I'm a medical doctor from Brazil. I am very happy to be here again, celebrating these 200 days of celebration of the International Forum promoting homeopathy. And it's a pleasure to be here to share 2 studies that I did in my clinic in Brazil. And also congratulate all the directors that are organizing this event. So important for the whole world, for all the populations in the world. It is very important, this first step that we are going to have more help to our patients all. And this presentation today is, I will present one of my studies about the treatment of patients with dyspnea and fatigue post-COVID-19 treatment. And I wanted to say that I am a medical doctor from Brazil, but I'm infectious disease, and I have more 4 specialties. My other specialization is in enteral and parenteral nutrition, general practice. And for the last 25 years, I'm studying traditional Chinese medicine and acupuncture and all the tools in traditional Chinese medicine. And during since 2015, I began to study homeopathy, and during my course, I began to write another theory linking homeopathy with traditional Chinese medicine. As I told you in my presentation on Wednesday, homeopathy was created by our Dr. Hahnemann from Germany, and homeopathy nowadays has 247 years of existence. And that's why I follow Hippocrates' quote that said, it's more important to consider other ancient medical traditions prior to knowledge we have nowadays. So I am using some of Hippocrates' thoughts, using traditional Chinese medicine reasoning to what we have nowadays in homeopathy. And you will see how I will use the reasoning in the treatment of these patients with this kind of symptoms. First, I will begin do an introduction. An outbreak of pneumonia began in December 2019 in Wuhan, China, and a novel coronavirus was identified as the causal agent and was later named severe acute respiratory syndrome coronavirus infections by the SARS-CoV-2 virus. On the March 2020 11th, the World Health Organization General Director announced that the coronavirus disease was the first pandemic caused by coronavirus. And the primary target organ of SARS-CoV-2 in the human body is the lung, and the primary representation of patients include the respiratory tract symptoms such as cough, fever, and dyspnea. And about 50% of patients with severe case of COVID-19 over the age of 60 years that considered high risks are patients that have lung or cardiovascular disease, develop dyspnea 1 week after onset of the disease, which can progress rapidly to acute respiratory distress syndrome, difficult to correct metabolic acidosis, coagulopathy, and even death. In this article, they are saying that 38% of patients studying this article had fatigue due to SARS-CoV-2 infection. And here I will show you cases of dyspnea post-COVID-19 treatment and fatigue post-COVID-19 treatment. This first case report is a 52-year-old woman. On September 4th, 2020, she began to feel changes in her body, but nothing significant. And the night while participating in an online lecture, she dozes off. And when she woke up, she felt very tired, which made her fall asleep again quickly. And the next day, since waking up, she felt a general malaise in her whole body, was sore, especially in the hip and leg muscles, and during the night, the pain intensified, not allowing her to sleep. And on September 6th, the patient realized that beside the pain she was having, neither taste or smell she was having. And the other day, in addition to all these symptoms, she started to have a runny nose and sneezing, which led her to go to the medical duty and have the PCR exam. And the doctor prescribed Flumucil for 7 days and Nevastel 10 milligrams, initially for 5 days, but it was exterminated for another 5 days later. And the pain in the whole body remained for about 7 to 8 days, and the runny nose quickly subsided. And in another 6 or 7 days, she reported back pain on the right side, which led her to take the medication ivermectin. And she remained in isolation for 14 days. And during this period, her symptoms decreased and she did not experience shortness of breath during this acute phase. And after only 17 days, the patient had medical clearance to return to work. And from the first day she went back to work, she began to feel tired throughout the afternoon and becoming breathlessness when she spoke. On the second day, when she returned home, she had shortness of breath that generated a panic attack because she was unable to breathe and had to work hard to recover from despair and to be able to breathe again. And this difficulty in breathing followed her all week, always in the afternoon, since she works with communication and needs to move between different sectors of all day. And in the before the COVID-19 infection, she was my patient. It was treating hypertension, hyperthyroidism, bruxism, and tinnitus. And her diagnosis, according to TCM, was kidney iron deficiency, blood deficiency, and iron deficiency. And also, I did the chakras energy measurement of her chakra before the COVID-19 infection, about 2 months after, and revealed that all her chakra were in the lowest level of energy, meaning the first chakra that corresponds to the liver were without energy, the kidney, heart, lung, and spleen, all were in the lowest level of energy. This means that the relationship between the yin and yang blood production was very impaired because all the organs were with no energy to work. For example, kidney is responsible for the production of yin and yang, spleen is responsible for the absorption of nutrients and formation of blood. Lung and liver is responsible for the distribution of qi or prana or vital energy inside the body, and heart is responsible for the maintaining the blood flowing inside the vessels. And what I did was the treatment of all her chakra using homeopathy medications, one for each organ that was weak and the weakest energy level of energy. She was using this medication, but because of the medication she used to treat the COVID-19 infection, that was high concentrated medication, probably her vital energy reduced even more, leading to the dyspnea symptoms after the acute phase of the disease. And in this In this theory created by me, constitutional homeopathy of the 5 elements based on traditional Chinese medicine, you can read this publication that was published last year in July at this journal. And to treat the first chakra, I use phosphorus. To treat the kidney, I use natrium muriaticum. To treat the heart, I use sulfur. To treat the lung, silicium, explica calcária carbônica. But the sequence of to give the medication is not exactly 1, 2, 3, 4, 5, but you need to give according to the sequence of generation cycle that I will show you in the next slides. When I prescribe this homeopathy medication in another higher potency, higher than she had intake in the past, this medication in the 30 ch, and after 1 month she intake the medication in 200 ch, and when she came back with this dyspnea symptom, I increased the potency to 1,000 ch, 1 bottle every day, not every 3 days. And on the 3rd day of the treatment, she improved her dyspnea symptom totally, completely with this kind of treatment. And also, I did the Chinese dietary counseling, avoiding the ingestion of dairy products, raw food, cold drinks, and sweets, because all these foods could induce the formation, the 5th chakra insufficiency, that is the spleen pancreas, according to traditional Chinese medicine, that is responsible for the absorption of nutrients. And when the nutrients is not, when the patient is maintaining the error in the habits, the foods, they could induce the maintaining the energy deficiency, and that's why it's very important to orientate the patient to avoid dairy products and use only cooked or foods and not raw food, and the water should be warm and not cold. And also, it's very important to orientate the patient to avoid the coffee, soda, matcha tea, because all these drinks could induce the 2nd chakra deficiency, that is the kidney, that is responsible for the formation of yin and yang. That's very important to maintain health. And also to reduce the ingestion of chocolate, honey, coconut, alcoholic beverages, because not because of the components, but because the energy of these foods could induce the formation of internal heat. And the internal heat is an energy imbalance generated by the deficiency of energy in all the chakras, for example, in her case, and is responsible, the heat retention is responsible for all the inflammatory process, very common in COVID-19 patients. And when you do all this measurement, replenish the chakras and orientate the patient what they need to eat, it will reduce very much the formation of internal heat, leading to less inflammatory process. And here is one of the procedure made by TCM, is the apex dilating, is one of the procedure to release the heat. And with this kind of procedure, we can reduce the internal heat, reducing the inflammatory process, very common in these patients, and also rebalance the internal energies using auricular acupuncture. In this treatment, as I show you, I am using traditional Chinese medicine tools for 25 years of my work. And that is why it's very common to you to see that I use very many TCM tools and use homeopathy medication when I needed to replenish or use any kind of medication. I always use homeopathy, never I use high concentrated medication, and I will show you why. With this treatment, she began to start better 3 days after the treatment without the dyspnea symptoms. And I will show you why this kind of treatment is important to treat this dyspnea condition in these patients. The second case report is a male patient about fatigue now. He's a 67-year-old male patient. On the afternoon of September last year, 2020, he started to have back pain. And on the second day, he felt his nose, that his nose was plugged, and the pain in the back continued. In the morning of third day, the nose and throat were tested, and after 2 hours, the test of COVID-19 was positive. And one doctor, another infectious disease doctor in my city, prescribed ivermectin for 3 days and azithromycin for 4 days. And afterwards, a corticosteroids was prescribed for more 3 days. And the tomography showed the adhesion about below 10%. And after this medication, he had fever for 1 to 2 days, about 38 degrees. And in the second week, after 7 days, the only symptom he lasted was the temperature, about 37 degrees. And after 15 days, he was discharged to work. And this patient is a dentist, and he only returned to work after 18 days. And when he went back to work, he began to felt a very important fatigue, mainly in the afternoon. And he was thinking even to stop working because the fatigue was very important. He was very weak in his energy, and he was thinking to don't work anymore. And this case report, he is my dentist, and he went to his clinic and told me that he was very fatigued after having the infection. And he was already my patient since 3 years ago. And therefore, I already measured his energy in 2018. It was all in the minimum level at that time. And he was intaking the homeopathy medications to replenish this chakra's energy that was already low, like in the first case report. And when he told me that he had COVID-19, but he didn't have the complications like to dyspnea or needed to be admitted in the hospital. He think that he didn't have so many complications because he was intaking the homeopathy to replenish the chakra's energy before he had his infection. And after the infection, I prescribed higher potency to him of that medication I showed in the first case report, but now in the 10,000 CH. And his medical history includes a very chronic kidney problem since childhood. He had hypertension, dental implants. Dental implants can reduce the vital energy or can reduce the chi of our patient. And it's very important to take care or to only prescribe these implants when it's very necessary, because it will cause many problems to the patients. And since 2021 years ago, he did these dental implants, and 5 years ago, he had a prostate cancer and needed to remove this tumor by surgery 6 years ago. And after 3 days of intaking the homeopathy medication, he was feeling normal, very well, only 3 days after the medication, and he was able to return to work normally again. And here's to show you that nowadays, the treatment of COVID-19 treatment is made at the leaf level of this tree. This tree is a metaphor of the human body, explaining the difference in the treatment of Western and traditional Chinese medicine, and nowadays homeopathy also is in the leaf level, like in Western medicine. But homeopathy nowadays could treat the root too. But what happens in homeopathy nowadays is that the treatment in the leaf level cannot be explaining what is the root of the treatment that is the patient is improving their symptoms. And that is why what traditional Chinese medicine, the difference in traditional Chinese medicine is that when the patient has symptoms in the leaf level, they understand that the leaf is only a symptom, but the problem is not in the leaf. The problem is on the root, or can be explained by the exposition to this external pathogenic factor influences. And TCM sees the patient as a whole. That is why I know homeopathy also sees the patient as a whole, like in traditional Chinese medicine. I always say that homeopathy is a Western traditional, Western Chinese medicine, because homeopathy works as traditional Chinese medicine, but using other kinds of medications. But the theory is like the same as in the book that I showed in my presentation on Wednesday. That I showed a book that compares homeopathy with acupuncture, and in this book they are saying that homeopathy works like Chinese medicine because working the same meridians and the energy is the same. And here's to show you that all the treatment that we need to do aims to balance the yin and yang theory, like this chart. The yin and yang needs to be in harmony in all the treatment that we do, in all the treatment, including dyspnea and fatigue. The aim is to balance this treatment. And this is a various combinations that you can see that the patient could have yin deficiency, yang deficiency, yang deficiency, yin deficiency. Here's to show you that this is another theory that I presented in 2015 in an acupuncture conference research that was held in Boston in 2015 at the Harvard Medical School, when I explained that the necessity of having yin and qi and blood in harmony in all the treatments to achieve health to the patients. And in this chart, you can see that yin and yang is produced by the kidney or the second chakra. The blood is produced by the fifth chakra or the spleen, and the chi is distributed. This chi is the vital energy, or prana in Ayurvedic medicine, is distributed by the first chakra and the fourth chakra, that is the liver and the lung. And as you can see in these both patients, they were in the lowest level of energy. And that is why the production of this energy was very was impaired. And when they use the normal antibiotics that they are prescribing, the majority of Western doctors are prescribing the antibiotics and ivermectin to the treatment of COVID-19. That's a virus. I cannot understand why they use antibiotics to treat the virus until today. But okay, what they are doing is only harming the vital energy of this patient and leading to some complication. In this case, I'm showing you two complications, that is dyspnea and fatigue, because they are inducing deficiency in these mechanisms of the maintain health. And here's another chart when there is some deficiencies in energy or a combination of these deficiencies. There is the production of internal heat, and this internal heat is responsible for many formation of many diseases in Western medicine, such as here, the deficiency of yin with the heat retention. This combination is the formation of diabetes, autoimmune disease, many women in menopause, and here is responsible for patients with depression, constipation, and many psychological treatment problems such as anxiety, panic syndrome, schizophrenia, and many other hypertension could be induced by the production of heat retention, and infection, dermatitis, urticaria also is induced by these energy imbalances, and even cancer comes from these energy imbalances, deficiency of energy and formation of internal heat. And that's why when we treat these kind of energy imbalances, we can take the patient that in this disease and lead them to the health again. And that's why when we are using homeopathy, we need to understand the mechanisms of the formation of the disease to choose adequately which kind of medication that can have this kind of action, reducing the heat and promoting the yin and yang, qi and blood replenishment again, to lead to the patient to a healthy state again. Here's to show you the second theory is the 5-element theory. Is different, this theory, from the Western medicine theory, because Western medicine say that each massive organ inside the body works independently, such as liver, kidney, lung, spleen, and heart. But in contrary, in Chinese medicine, in this 5-element theory, they say that all internal organs are interconnected by the energy flow. And this energy is the vital energy that homeopathy is saying, and is prana in Ayurvedic medicine, and in Chinese medicine it says qi. And qi is this energy that is moving from one element to another, and one element can control the functioning of the other element, to one element don't overcome the functioning of the other. And in this case, you can see that the kidney sends energy to the liver, that sends energy to the heart. The heart sends energy to the spleen, and the spleen sends to the lung, and lungs to the kidney again. And in the case of COVID-19 treatment infection, the patient when have fatigue or dyspnea is when the lung sends energy to the kidney when do not have energy to receive this energy, this transmission will be blocked, and the blockage of this transmission is when the patient begin to feel the dyspnea symptom. The dyspnea is the blockage of this energy flow from the lung to the kidney, leading to this dyspnea manifestation. And that is why when you begin the treatment and replenish, giving this energy to these organs, the patient will improve the symptom again. And not only the medication, here you need to orientate the patient to drink so much water, and the water it's better to don't be cold water, because cold water could induce the energy disturbances of this spleen energy meridian. And that is why it's important to orientate the patient to drink lukewarm water, to be the water in the same temperature of the internal body. And also the quantity of the water is very important, because water is the main source of energy to the kidney. And when the patient has dyspnea, the first thing that you need to orientate the patient is to ingest so much water and avoid the ingestion of dairy products, all cause milk, because dairy products can retain, they can retain water inside the body, and this water don't go to the kidney, it's inside the body, and the patient begin to feel edema, and that's why he is full of water, but it's not going to the kidney. And that's why it's very important to orientate the patients to avoid the ingestion of dairy products, because the water that he's retaining in the body, it's not going to the kidney to give the kidney energy. And that's why all these tools is very important, and you need to understand the mechanism inside the body to understand why you are giving this kind of homeopathy to the patient in this situation. And here is to show you that I always orientate the patient to avoid the chocolate, fried food, egg, honey, because this kind of food can induce this energy imbalances, leading to the formation of heat retention. And when the heat is very imbalance leading to heat, it will compromise the kidney here or the heart here too. And here in the heart, it will give some symptoms of palpitation, and the imbalance of this gallbladder meridian can increase the fear, because each organ is responsible for one external sensorial organ and one emotion, and the emotion that can imbalance this liver and gallbladder is fear, and the imbalance of this energy will produce fear too. And the other organ that could imbalance with fear is the kidney. And when the patient is feeling so many fear nowadays because of the fear to have COVID-19 and fear of so many things, they can imbalance this kidney, also leading to dyspnea symptom. And that is why we need to treat this kind of imbalance of these energies to reduce the fear symptoms and reducing these dyspnea symptom in these patients. According to Hippocrates, the manifestation of the disease is only the body's reaction against the external pathogenic factors. In every infectious process, there is a fight for energy inside our body to try to eliminate the external pathogen, causing a consumption of this energy that is already in the reserve total. Why I'm showing you that they are in reserve? I told you in this 2-case report that they do not have energy measured by the radiesthesia procedure. And also, I don't know if you saw my presentation on Wednesday, that I am saying that the majority of the patients that I am attending nowadays in my clinic, about 97% of 1,000 patients that I measure in 5 years, they do not have the Zen Ki energy. What's Zen Ki? The Zen Ki is the energy of the kidney energy. That's the second chakra that is responsible for the protection of the human body, the human being, for the invasion of any external pathogenic factors. And as I show you in my presentation on Wednesday, any entrance of the external pathogenic factors is considered the external pathogenic factors. In this case, COVID-19 virus is considered the invasion of one external pathogenic factors. And depending on the type of the external pathogenic factor that invades the body, the patient will have some manifestation depending on the type. And the type of this external pathogenic factor could be entrance of wind, or entrance of cold, or entrance of heat, or entrance of wind, and humidity and dryness, and depends on the energy imbalances that each patient has inside the body, and depends on the entrance of these external pathogenic factors that is going inside together with SARS-CoV-2. The patient will have different clinical manifestation. And here's to show you that the lung is the first organ that is affected by this invasion, because the lung is in the top, is the first organ that when the virus is invading is affecting the lung. And the second is the stomach and the spleen. And this organ, each organ here has one external sensorial organ that they command. In this case, the lung commanded the nose and is responsible for the sense of the smell. And the spleen and the stomach is responsible for the mouth and is responsible for the sense of taste. That's why in the patients with COVID-19 infection, it is very common to see the clinical manifestation of anosmia and lack of taste and smell, because all these organs are compromised, but the first organ that is affected is the lung and spleen that is involved in the SARS-CoV-2 infection. And the kidney, it is the other organ that it's very common, because the majority of the patients that we have nowadays do not have energy in any of the chakra, including us that I showed in my presentation. I think we are in the lowest level of the chakras too, and we need to treat these deficiencies in the energy. This is not only the patient that is in the high risk patient that they were saying in the COVID-19 last year, in the beginning of the pandemic. They were saying that only cancer patients that had myocardial infarction history or have diabetes, hypertension, patients that were intaking corticosteroids or have immunosuppression due to the constant use of medications. But now we can see that all kinds of patients are having COVID-19 infection. Not only these old persons, but the adolescents, the children, and the young adults, all are having problems and even dying of it because of these energy deficiencies. And here I'm showing you that here the spleen. The spleen is the other organ that is imbalanced because of the lack of the energy in the spleen. And the lack of energy in all the chakras energy center is compromised in this infection of COVID-19. That's very common in this patient when using high concentrated medications such as this hydroxychloroquine and azithromycin and many other medication that's high concentrated. It is very common to reduce this vital energy even more because of the Arndt-Schultz law that I will show you. And here is to show you a chart that I show you in my presentation on Wednesday. I will show you again. When the patient has a strong Zenki, that's the energy of the second chakra, he will, and the Sheki is lower, he wants to have this infection because Zenki will protect these patients. But nowadays, the majority are in this level because the Zenki in all our patients in our body also are in this situation. And this is because one of the theories is the influence of the electromagnetic radiance into in the whole body, leading to the harming our vital energy. And the Sheki is bigger than the Zenki. That is why when you have a Zenki strong, that's in this situation, you don't need to do anything because it's Sheki, that is the virus, and the external pathogenic factor cannot go inside the body because it is protect our body. In this situation, the zinc key of our patient is low. That is why we need to treat to maintain the zinc key strong, like in the first situation, to reduce the transmission and reduce the complication and reduce the necessity of hospitalizing these patients. And here is one of the publications that I showed the treatment of asthma based on traditional Chinese medicine, homeopathy. I'm saying in this publication that according to TCM, asthma is not a manifestation of disease in the lung, but the problem is in the kidney because of that energy transmission and the lack of energy in the kidney, leading to asthma symptom. And asthma, in this case, you needed to treat the kidney and not only the lung, differently from the Western medicine reasoning when they treat only the lung. And using homeopathy, why homeopathy? Because homeopathy cannot reduce even more the vital energy that normal medication used in Western medicine are reducing. And that is why homeopathy is the drug, is the kind of medicine of the choice nowadays, because the majority of the patients nowadays are in the lowest level of energy. And that is why we need to use homeopathy, only homeopathy, to even don't to harm even more the vital energy that's low. Here's the Anschutz law that I demonstrate in all my presentation. In the presentation on Wednesday, I will repeat again for those who didn't see my presentation. It was created in 1888 by two German researchers, and they are saying this law that the use of high concentrated medications such as antibiotics, anti-inflammatory medication, antidepressants, anxiolytic medication, all medication in high concentrated can reduce the vital energy of this patient. And this is why it is not indicating patients that is having COVID-19 treatment, because all of them has deficiencies of energy in the chakras energy centers. And when you are using this kind of medication nowadays, you are harming the vital energy, leading to so many complications: the dyspnea, the fatigue, the renal insufficiency, the respiratory insufficiency. It's not because the virus itself, but it's because the use of this wrong kind of medication. That is why in this case, I'm using only homeopathy, high diluted medication to increase the vital energy and reducing the production of internal heat that is the energy imbalances, leading to the inflammatory process and leading to the complication of bleedings and stagnation of blood and leading to intravascular coagulation is also caused by these energy deficiencies. And all these explanation is very important to the doctors that work with homeopathy, because you need to understand the mechanism of the formation of the disease in all kinds of disease to you to understand what is happening in the energy level to you to choose adeptly each drug, or how is the mechanism, the formation of the disease to you to treat adeptly of our patients. And you need to understand all these explanation. This explanation was, I did this explanation, but this is all the explanation I have in the Chinese medicine, but there are some explanation in homeopathy and some explanation in many kinds of traditions to you to understand the formation of the disease in the energy point of view. And in Brazil, homeopathy was recognized as a medical specialty by the Federal Medical Council in 1980 and acupuncture in 1995. And one of my presentations I did last week in the diabetes webinar, one doctor from US, they asked me why you are using it, not you are doing something illegal. No, in my country, in Brazil, I'm not doing anything illegal because homeopathy and acupuncture is considered medical specialty. And I don't know what is the situation in the whole world, and if we are not recognized by as medical specialty, we need to fight and to have this recognition, because it's very important to us to work as a medical specialty, as in Brazil. In Brazil, we are recognized. And it's important to have in mind, you can see TCM here, but you can see homeopathy here too. Homeopathy and traditional Chinese medicine and Western medicine, we need to see as a whole and not looking only in Western medicine, and not only looking at homeopathy, but all the medical traditions need to be in mind to treat the patients adequately nowadays. And the conclusion of this study is that the patient with dyspnea and fatigue of SARS-CoV-2 infection treatment have internal organs energy deficiencies prior to SARS-CoV-2 infection, and the treatment replenish the chakras energy using high diluted medications such as homeopathy. According to the theory, constitutional homeopathy is very important to recover all the patient's symptoms, in this case, dyspnea and fatigue. According to Hippocrates, it's far more important to know what person the disease has. No, to know what person the disease has than to know what disease the person has. He's saying that we need to treat the patient and not the disease. We need to treat the patient and not the COVID-19. And if we treat the patient, the COVID-19 will not happen, because we will fortify the patient and the disease will disappear completely without needing to treat the disease. Thank you for your attention. If you have any question, I will say something about my second presentation about vaccination. And I think I will say something, and after we can open to discussion, because I will say only 5 minutes, and I will open to discussion to 10 minutes to us to discuss, okay? Yeah. I have this study that I am saying, I'm presenting in some webinars. And are we vaccinating immunocompetent or immunocompromised people for COVID-19? Because nowadays, I think they are thinking that all of the population of the world are immune competent. But in this study that I will show you that the majority of the patients are not immune competent. Because in this chart, that was the research that I did in my clinic from 2015 to 2020, I showed you. I measured 1,000 chakras energy from all my patients, and they vary from ages from 2 to 80. And from these patients, 70% were in this situation. They only have energy in the spiritual chakra. There's the 7. The first, that's liver, kidney, heart, lung, and spleen, are in the lowest level. They don't have any energy. And in this study, they don't have any diagnosis such as cancer, diabetes. Majority only have anxiety, headache, depression, many common symptoms that we don't consider that they are immunocompromised. But in this situation, I'm showing you that the majority of our patients are in this level of energy. And here is another 20% of this study don't have energy in the 7th chakra too. And they have only anxiety, headache, knee pain. And I'm showing you that a patient that has anxiety, and this kind of common diagnosis, they can have chakras energy deficiencies, and they are considered, in this case, according to TCM, they are immune compromised, because energy means immune system. And when our immune system is, our energy is low, our immune system is very immune compromised. That is why we are underestimating the level of immune. Here the question. So are we not underestimating our immune compromised population? Are our immune compromised much bigger than we think they are? Because in this study that I saw today, and I put in this slide to you to know that there are persons that having intravascular coagulation after vaccinating of AstraZeneca vaccine, but they don't know why they are having blood clots. But according to the theory that I demonstrating, to the patient have to the blood here, to the blood circulate adequately, they need to have yin, yang, and qi. And I said to you that all these organs that is producing this energy are very compromising all our patients. And that is why the blood cannot circulate inside the body when there is deficiency in the energy. This yin yang in the second chakra, this is the first and fourth chakra, and this is the fifth chakra and third chakra. All are compromised. That is why some people that is receiving these vaccines and after COVID-19 infection, they have so many complications, but are in the energy level. And you need to understand these energy deficiencies leading to this complication. And all the patients that are receiving that vaccine nowadays that are having complication could be caused by these energy deficiencies. And this is the only thing that I want you to understand, and only I will open to some discussion. If you have any question, I will be very happy to answer you. Thank you. I think there are someone that raised hand. Someone wanted to do some questions. Hi, Elio. We have more comment, 7 minutes to stop. And if you want to discuss something that I said, something that you think that I'm wrong, you can share with me, because this way of thinking is according to TCM, but I know that the majority of us using homeopathy use another kinds of reasoning. And I will be happy if you can share some of your thinking about this explanation and about my way of thinking. Thank you. Elio, are you hearing me? Yes? Can you discuss with me? Tem como colocar? Can unmute yourself too. Can Como? Hélio, can you unmute your phone to me to speak to you? Como que faz? Fala no chat aqui. Oh,
Okay. Agora sim.
hi. Hi, Hélio.
Olá, Wang. I'm speaking in Portuguese. I would like to speak in Portuguese later, but now I can speak in English.
Okay, okay. Do you have any experience in the treatment of dyspnea using homeopathy?
No, I have no experience to treat specifically with in COVID. I have not. I've treated a few patients only.
Oh, okay.
And one of the patients, it was myself.
Yeah, you had?
Yeah, I treated it together with the homeopathy and also with the ivermectin.
Yeah?
Yes, both things. And I think it's a good combination. And I saw that you also were using these two kinds of approach, meaning not only traditional Chinese medicine, but also homeopathy and ivermectin. I found that ivermectin is a very interesting drug. And I was very surprised also because of the good results I had. So I think that we must have an integrative approach, and the explanation you gave about homeopathy and Chinese traditional medicine was very interesting, and together also with the chakras medicine. So.
Yeah.
So you run a lot of different countries, India, China, and the Occident with homeopathy. It was very, very interesting. I really appreciate very much your approach, and
Oh,
I believe we can we must face the problem of COVID in this multi aspects, not only one, and I think it's a good idea. So my congratulations to your presentation. I think
oh, thank you. But can I ask you one thing? Are you using the prophylaxis with homeopathy in you or in your patients with
yes,
using homeopathy?
Yes, what I use is the proposal of the Scientific Council of the Indian homeopaths with arsenic carbon 30 ch at least once a month, and it can be given with other possibilities. But even in this condition, some people they got the disease. So maybe they have less, not so much, not with so much gravity, so much intensity, but nevertheless, it depends on many people. You know, it depends. The COVID is really a very contagious disease. This is my impression. And also we must be careful because in some cases that we don't understand yet very well why people develop a very serious condition, and this must be taken in account. It's in some people, and we don't understand why people get very serious illness. And also in my family, I observe that some people who can be asymptomatic, so with no symptoms at all, and then suddenly you can be surprised by what happened with your lungs, with the lungs. So some people develop this kind of phenomenon of the lungs with reaction, and I was surprised also with people that have about 7 days after the starting of the disease, they get problems with the lungs. But in this, many people they have this problem, but they don't know that when you make a scanner or you make an X-ray, you are surprised by the images you see there. So I must, in my opinion, these diseases must be treated with very caution. We must be very attentive because we can have bad surprises. That's my
Yeah.
opinion. Bad surprises.
Okay. Thank you for your comments. Now we are finalize my time for Brazil. I'm sorry, but I would like to talk to everyone here to see your opinion, but I need to stop here and lead to another country now. Thank
Okay,
you
ma'am.
all for your attention and have a nice evening to all. Thank you.